Hello, everyone. My name is Anna Allen.
I'm Sophie Allybone.
I'm Jada Gregory.
I'm Alina Matthew.
Today, we will be doing a presentation over rabies. So, we all love our furry friends in our lives, but let's think about the impact of when they fight back, so to say. So, in this presentation, you are going to be learning about what causes rabies, its signs and its symptoms, how it's transmitted first in between animals themselves, and then how animals transmit them to humans, the epidemiology of the disease, how it can be prevented and controlled, and what the treatment looks like. So here we have an introduction slide to what rabies is. So rabies is a zoonotic disease, meaning that it's a disease that exists primarily in animals, but will affect humans. And it's typically more severe when it does. It has this common name of hydrophobia, which in later slides you will learn that the virus causes one to not be able to swallow due to some esophageal spasms, which gives it that name of hydrophobia because they cannot swallow. So rabies disease itself is caused by a rabies virus or a Lisa virus, and it's a member of the Rhabdoviridae family. So the Lisa virus is a form of a virus that causes encephalitis, which affects the saliva and the nervous system. And it's a neurotropic virus that causes rabies in humans and animals. So here we're going to be talking about the structure of the rabies virus, and it is a bullet-shaped bacteria. It's enveloped. It has a single-stranded negative sense RNA genome. The envelope is going to be a lipid-containing bilayer with transmembrane glycoprotein spikes. This internal core protein, the nucleocapsid, is going to contain Negri bodies, which are going to divide once inside of the brain.
Okay, so first I'm just going to discuss the signs, which are going to be physical attributes that you'll see. And there are two periods when you contract the disease. There's going to be the incubation period, which is before you really see like any major signs. And then after that will be the prodromal period, which is where you see the like actual severe signs. So the thing with rabies is it has a really long incubation period that can last from a few weeks up to a year. So the early onset signs are pretty much virtually like non-existent. And most people, the reason it's so fatal in humans is because we don't realize we have it until it's too late to kind of have any medicine to help with the disease. But the later signs will include increased salivation, difficulty swallowing, which is what we discussed earlier with it being a hydrophobic disease. Basically, when you're producing saliva and swallowing, you'll have these esophageal spasms because the disease is hydrophobic, and that can be due to the phospholipid bilayer with the lipids. And you'll also see frothing at the mouth, again, because you can't swallow, all that saliva is going to come right back up. Then we have symptoms, and symptoms are going to be like physiological attributes, so you're not really just going to see it. And then again, from the incubation period, the early symptoms will be like twitching and tingling at the infection site. So it'll just feel like itchy, kind of similar to a bug bite where it's not crazy noticeable, but you know it's there. You can have a fever, a headache, nausea, sore throat, and fatigue. And although these are like symptoms that you would notice, most people can have these type of symptoms just throughout their day-to-day lives, depending on how they are and health-wise, which is why it takes so long, like up to a year before people realize they have rabies. And then the prodromal period, that's when it really starts to like affect your nervous system. So you'll become way more agitated, you're confused, you can suffer from hallucinations, seizures, increased sensitivity, and then encephalitis. And that's going to be inflammation of the brain. And I'll discuss that a bit later when I'm talking about how it's transmitted to humans, but it kind of just talks about how the disease is multiplying in your brain. Okay, so from transmission to animals, just discussing how animals can spread it between themselves. Animals just contract rabies from other infected animals. There's no real like patient X type situation going on with this disease. And animals have a similar type of response that humans do, where they don't really have many like early onset symptoms, but animals do have stronger immune systems than humans. So we do have some like more noticeable early symptoms. And the disease, once it's in your, like when you get bitten, the disease will travel through your neurons into your brain. And that's where it'll multiply. It doesn't just like stay in your body, it goes straight to your brain. And it can only be transmitted through open wounds, scratches, abrasions, and mucous membranes. So if you get hit by an animal, but it doesn't break your skin, obviously still go to the doctor, but you're most likely going to be fine because it hasn't actually entered your blood system. So transmission from animal to human is going to be just from bites from an animal that does have rabies. Again, it has to actually break the skin to enter your system. So the virus will multiply a little at the site, and then it will travel along those neurons to infect the brain like we discussed. But the crazy part is it has this thing called viral release, and that's where after the year is up, where you like have had that virus multiplying in your brain, it does a thing called viral release where it's ready to kind of be spread among other people. And that's where the virus will then leave your brain and it'll travel into your salivary glands. And that's where it becomes active for transmission. And then there's these Negri bodies, and that's going to just be like the body of the cell, what that will actually, it's in the nucleocapsid, and that's what will start to multiply and actually lead to like the exponential growth of the virus within your brain. And an interesting thing is the only cases of human to human transfer is going to be through infections through transplants. So there's no actual recorded cases of humans biting other humans and transferring the disease. It's only through transplants. So the most common way is being bitten by an animal that hasn't been treated with the rabies vaccine, and that's how most people will get it.
Okay, so here we are going to be talking about the epidemiology of rabies. So, as we said before, its primary mode of transmission is the saliva in the bite wound of a human. So, the most common animals that are going to do this are raccoons, bats, skunks, and foxes. More specifically, bats, as you can see in this chart to the left, they're going to be the most common thing. The reason why dogs aren't on this list is because we're talking about in the United States. And in the United States, we have vaccine mandates for these animals to prevent that. So that's why it's rare in the United States. You're only going to have 1 to 3 cases a year. So it's pretty controlled. Your most common cases of rabies are going to be in locations where you're not going to have mandates for vaccinations for animals, like Asia and Africa. So Asia is the most common rabies infections, and then Africa follows. And then yearly and globally, we're going to have 40,000 to 70,000 deaths. So that is a lot of people.
So now we're going to talk about prevention of rabies. So rabies can mostly be prevented by keeping distance from wild or stray animals. So this includes stray dogs, bats, cats, and raccoons. And you can also prevent rabies by learning body language of animals. So if you recognize a dog to be aggressive, you can immediately keep your distance from the dog and contain it in a safe area. And then you can also supervise your pets from other people and also vaccinate your pets, which is the main number one way of preventing rabies. And then also, if you get bit by an animal or any stray animal, the best way is to immediately wash the area with soap or any other disinfectant, and then lead the animal to a safe area and then seek help right away or go to a clinic. And control in the United States, there's many rabies control areas or clinics in each county in the United States. And each county is responsible for keeping the citizens controlling rabies and transmission of rabies to other animals as well. And most cases are reported to the CDC. And then in the state of Georgia, there's several laws against transmitting rabies. So they usually control rabies by requiring a person to report an animal suspected of rabies. And also the law requires all pets like dogs and cats to be vaccinated.
So treatment for rabies has differed over the years. In the early cases before medicine and antibiotics and improvements in medicine occurred, cutting away the flesh in and around the infected area and then burning the wound with fused silver nitrate was a common practice known as cauterization. It's a medical practice and it was performed because antibiotics and improved medical methods weren't around. And this was before Louis Pasteur developed the first effective vaccine against rabies in 1885. However, in later cases, with the use of Pasteur's vaccine, a Philadelphia company created a new rabies treatment kit that could be shipped to doctors. And the treatment consisted of 25 injections of rabies vaccines, and they would be implemented 3 doses on the first day, 2 on the second, and then 1 dose each day after that for 18 days. Each dose was more virulent than the last so that the body could build up immunity. Because the vaccine had to be fresh to be effective, it could not be stocked by pharmacists, so it wouldn't be on the shelves, it wouldn't be kept away, it would have to be used right at that moment. And the whole purpose behind the kit being shipped to different doctors was to prove that the best medicine is of no consequence and it's useless if it's not available and affordable. So today, post-exposure treatment consists of 4 doses of the vaccine given over a 2-week period, and it's commonly injected in the upper arm. So, impact of rabies from an individual to global scale. Rabies attacks the central nervous system, as we mentioned before, and in humans as a range of symptoms from increased anxiousness to partial paralysis to hydrophobia in its final stages. Children are the most common victims. When it comes to rabid dogs or stray dogs, they're more likely to be bitten and more likely to be exposed through multiple bites to high-risk sites on their body. Global source of rabies in humans is from uncontrolled rabies in dogs. That's not usually a common problem in the US, where we have vaccine mandates and we spend 300 million annually to prepare our dogs and keep them vaccinated. It's more so in undeveloped countries. Worldwide, there are 59,000 deaths annually. And as I mentioned before, most of these deaths occur simply because other countries don't have the resources. It's not a big priority for them, or they just don't have the money to make that a priority.
Okay, everyone. So I'm sure at this point you know all about rabies, but we're going to go over what we have learned in this presentation. So rabies is a lyssavirus, and it's also a zoonotic disease, meaning that it's spread from animals to humans. Common signs include frothing at the mouth, and symptoms would be encephalitis. Transmission can only occur through saliva and a wound typically a bite. So the most common cases of rabies are in Asia, followed by Africa. Vaccinating animals is the best use for prevention. And once you're infected with rabies, there's really nothing that you can do unless you catch it early and are able to get injections from not allowing the virus to take hold. So that is all. Thank you.